We all know the world's population is growing, and as it increases, the number of people likely to fall sick goes up too. Here in Scotland, the Scottish Ambulance Service is on the front line of patient care. We're dedicated to ensuring we respond to patients in the most effective way possible, by delivering the right care to anyone who needs it at the right time. In November 2016, we introduced a new system changing the way we respond to 999 calls. The new clinical response model replaced an older, outdated system that hadn't changed much since its introduction in 1974. In those days, ambulance drivers would pick the patient up and make them more comfortable before transporting them to the nearest hospital. Nowadays, we live in a very different world. Paramedics and technicians are trained and qualified healthcare professionals. They can diagnose patients at the scene, treat them, and make clinical decisions about where a patient should be taken. We've even developed new advanced clinical roles, allowing these specially trained staff to make a range of decisions previously reserved for doctors. The new clinical response model is built around these skills, matching the patient's needs with the skills of the ambulance service workforce. Let's have a look at how it works. Within seconds of a 999 call being put through to one of our ambulance control centres, our call takers will have identified whether or not a patient needs an immediate response. For those critically ill patients that do, resuscitation advice and the location of a defibrillator will be given to the person making the call. Meanwhile, multiple responders will be sent to the scene, supported by enhanced cardiac arrest response vehicles. As every second counts for these patients, they remain our utmost priority, so much so we'll often divert paramedics heading to less sick patients. For others who are not in any immediate danger but who need further assessment at hospital, we'll aim to ensure the first ambulance response we send has the ability to transport patients. After all, there's not much point in sending a paramedic on a motorcycle if the patient needs to go to hospital. Once on scene, our crews will assess the patient and, depending on the diagnosis, they'll be transported to the most appropriate location, whether that's a hospital or a specialist unit. For those patients who don't need to go to hospital, it may be more appropriate to carry out a face-to-face assessment or deliver appropriate care advice over the phone, either from one of our own clinicians or by referring them to NHS 24. For face-to-face assessments, our crew might treat the patient at home or refer them to the best service for their needs. Patients who are not critically ill might sometimes wait longer for an ambulance response, but by prioritising the sickest patients, we're saving more lives. And the number of patients surviving for 30 days has increased by 43%. We're proud of the work our staff are doing to improve patient survival rates. The new model is helping us focus on matching the response we provide to the needs of individual patients. For more information on the new clinical response model, visit www.scottishambulance.com.